like to bring on, I was about to say Em, but that's because we're pals, but it's Emma Halston, but I'll call her Em because it's fun, isn't it? It's just girls together, who is a wonderful fundraiser for Eva Peel, excuse me, and advocate for small cell ovarian cancer. So Emma, can you shuffle yourself? Where are you? There you are. We've both got that afternoon light on us now, haven't we? Yeah. I know. When we all wait backstage before we start these sessions, and we logged on an hour ago, and it was just kind of normal. But as we're clearly sat in our rooms that have got whatever east, west, I don't know. I'm creative.
But it's unfortunately I'm not going to win.
No, just leave it. We basically just look like angels, Emma. Don't worry. I'm with you on that. Thank you so much for joining. Thank you for taking the time
to having me
to chat to us. Oh no, well, there aren't many of you around, Emma. So
no.
the small cell, it's so rare. So I had no choice but to ask you.
I know there's plenty of us. Well, maybe picking up from some of what we've just heard from Will, actually. I am that. If there was a pie chart and there were like little sections of pie charts to sort of show the different types of ovarian cancer, mine would be like the tiny slither, which is the non-epithelial cancer. I think I'm getting that right. I'm not the scientist, but it's the small cell cancer. So my diagnosis is small cell carcinoma of the ovary, and I have the hypercalcemic type that Will mentioned when he was talking about it. So I feel I was fortunate to have that because it helped me become a little bit more aware that something was off because I had some symptoms related to that. So it was also a very large tumor, as Will sort of talked about. It grows really, really fast. So I was surprised when I was told how large it was because I didn't know sooner, but it had grown really, really fast. So that's how I'd sort of missed it.
So take us, I hate the word, like we were talking about this yesterday, we had a little prep call because I like to look after my people. And we were talking about like the wording around when people have cancer. And I know Emma doesn't care, so she's very chill about all of this, but I sometimes cringe at the kind of take me to the beginning of your cancer journey type phrasing. But that's exactly what I'm going to ask you to do. So like, how old were you when you thought something's not right? Did you think something's not right? Like what happened? How come we're talking today?
So I feel like I was quite a well sort of I'd buffed up on cancer and what to look out for, especially breast cancer, sort of the things that affect you when you're a little bit younger in life. So I was 29 years old, and I was kind of slightly older in the average age of being diagnosed with this cancer. But I certainly wasn't looking out for any signs of cancer. There's not really cancer in my family either. So it wasn't something that I was really particularly worried about, especially in my 20s. I started feeling quite unwell. I was, living a pretty busy lifestyle. I had a busy job. I was socializing. I was actually at Glastonbury when I really felt like something might be off. So,
yeah.
I was having fun, but I was really tired. And I actually needed a wee all the time. And so much so I had to get up. I had to unzip my tent at 4 a.m. at Glastonbury to go for a wee. And I thought, normally I don't need to quite get up so early. I can make it through the night. So
I think you're a complete loser for already being asleep at 4 a.m. at Glastonbury. Well, you should have said I was raving away and I needed a wee. The fact that you had to get out of your tent, why bother?
Well, that's it. I was like, if I'm this desperate, I have to get out my tent and go all the way to the lift. Anyway, there were a few things like that. I was very tired. I had a loss of appetite. Many of the things that are related to some of the ovarian cancer symptoms. Anyway, I was losing loads of weight because the hypercalcemia didn't help with the loss of appetite. That kind of even exacerbated that more. But I was putting on weight around my middle, so I bought some new jeans, but they didn't fit. So I was a bit discombobulated by it all. But really the going to the loo bit was the thing that made me go, this isn't right. I'm in my 20s. And so I'm going to go and get myself checked out at the GP. And then again, as I said before, I felt fortunate that it was quite a large lump. So the GP was really thorough and thought something was a bit off and just had a little feel of my abdomen and then felt a very large solid tumor in there. And So immediately could tell me, oh, something's not right. And I think that's something that probably will need removing and probably be an operation. But because you've got some of these other symptoms too, they sort of fast tracked me. The NHS fast track sort of 2 weeks of let's get to the bottom of whether or not this is cancer. And so I had a blood test, and there's something called CA125 in ovarian cancer, which is often a blood marker that if it's elevated can tell you that something might be wrong. And mine was a little bit on the fence. It was elevated.
Oh, that's so annoying. You either want a nothing or a through the roof. On the fence, it's like, is that something? Is that nothing?
Yeah, so I had to just, it was a bit of a long wait to find out my diagnosis. So I had to go through, I was sort of fast tracked through a lot of the hospital appointments because the scan showed a large tumor in there on one of my ovaries. And I was coming to terms with the fact I was going to have to lose that ovary. And I was still thinking, hopefully it's just a weird cyst. And it's one of those weird cysts I hear about that's not actually cancer. And then it took an operation. So I ended up at the Royal Marsden. They operated and treated it as though it was cancer. And then I think they sent it away to somebody a bit like, again, we'll mention somebody called Glenn McGluggage, I think. Someone that was a really specialist at kind of diagnosing a tumor. And it took that little bit of extra time to kind of figure out that it was a really rare tumor.
That's interesting that you say. So you had the scans, and like the little almond ovary was like had this big old thing. So that was something was
Very
going
big.
on,
Yeah,
very big.
17 sort of centimeters, I think. So
wow.
yeah.
Okay. So an ovary, as Will said, is the size of an almond. So like that. And then you had something 17 centimeters. That's okay. So no wonder your tummy was getting bigger. Your GP prodded it and could feel something. But it's interesting, isn't it, that you received the diagnosis after the surgery? That's a kind of an unusual way around in the cancer world, isn't it?
Yeah, I think because they couldn't really take a biopsy very easily ahead of like a big surgery, and then it took them a while they can do a little bit of a test in the surgery itself to try and figure out whether or not it's a malignant tumor. But it took them 2 weeks after that to get this proper diagnosis back. And I was really fortunate being in London and at a cancer specialist hospital. They diagnosed it properly because quite a number of people I know have been misdiagnosed and then sometimes tried treatments that don't work, and that can, waste time, precious time. And so I was very, very lucky to get a quick diagnosis.
Do you mean they've been misdiagnosed to have a different type of ovarian cancer?
Correct. Yeah, because it's quite hard sometimes to, if your hospitals, there's lots of people saying this in the States or in a kind of local little hospital, they try their best, but they don't have all of the stains that they would use for a tumor, and so they kind of think they know what it is, but they don't quite get the right one. So. I was fortunate to be at such a large cancer institute.
And when you had the surgery and had to wait a little while, but then it was confirmed it's this type of small cell ovarian cancer. So, I hate asking this because I know what it's like, but how did you feel? Was it kind of like, I knew it was kind of a confirmation of what you knew already, or did it still take a while to sink in that, oh God, okay, it actually is this?
I think I had been very optimistic. I'd sat in that cancer hospital going, oh, I shouldn't be here. I've just got a weird cyst. And, but then when I was told, and I also have got that sort of thing of, cancer's very treatable these days, but it was quite a kind of, a difficult thing to deal with because they said it's this rare cancer. It's quite it's a very aggressive cancer and the prognosis isn't great. And I sort of say that, and I'm a few years down the road now, and it's kind of, in a way, there's so little statistics out there because there's so few people, and a lot of the treatment back in that people base prognoses on are all kind of outdated or older treatments where people didn't have so much sort of information. So I feel like in a way you kind of buck the statistics because it's so rare, but it was quite a difficult thing to deal with. So that and the doctors took it really seriously where I was at. So we tackled it with we'd removed everything we could find in surgery, and then they said 6 months of chemo, and I actually had the chemo that you would have if you have testicular cancer.
Yay!
So I had something called BEP, and so that was quite hard going, and I lost my hair, and it was 6 months of downtime, and then I had hoped that would be it, but unfortunately I did have an 18-month gap of getting back to life, but the tumor is aggressive and it came back. And so
after your chemo, the 6 months of chemo, did they kind of say, okay, we think you're good obviously we'll check up on you, but as far as treatment's going, you are good to go for a bit?
It's difficult because they'd only ever treated a case in the hospital 10 years before, and they'd only ever taken it to the chemo stage. So they had hoped that would work, and that would be good for me. But like it was lucky it hadn't metastasized for me when we caught it. But each case is so different. They don't really know. So they just want to keep a close eye on me. And then in the meantime, I had read lots online and kind of done a lot of research myself, thinking I'd like to have a plan just in case things do come back. So I'd found Will during my journey of looking for information, and done things like there is a related gene mutation for my tumor, which is, as Will mentioned, it's the SMARCA mutation, a bit like the BRCA mutation for breast cancer. This is like the equivalent for our cancer type. And Will confirmed that I had that, but I was lucky because it wasn't an inherited thing. So I was, nobody, that's why I hadn't had any cancer in my family. And actually, it was a relief because I have a brother and he doesn't have ovaries, so he doesn't have anything to worry about. But if he chooses to have children, I didn't, it was good to rule out the fact that he could pass up to somebody else.
It must have, as hard as it obviously was gaining all of this extra information and kind of what looked like kind of quite dark statistics, I can imagine that it was a slight relief to know that like parents, siblings, nieces, nephews, etc. wouldn't be affected.
And then with learning that information, I found out about some other treatments as well, which were possible things to try if I needed to. And so when it did come back, I had a couple of ideas to take to my oncology team, which was really helpful. I had a drug trial that I knew about, so I actually almost immediately, because I'd already had the tumor mark confirmed, I could get onto that drug trial quite quickly. And then unfortunately it didn't really do much for me, and then I had to think of something else to do. And so again, I followed the advice of some of the people I'd spoken to researching, and tried immunotherapy and a bit of radiotherapy. And I was really lucky because that worked amazingly well for me. Although the slight complication was because it's not tried that type of immunotherapy for ovarian cancer in the UK. It's not available on the NHS. So I had to drum up quite substantial amounts of cash for that, which I managed to successfully do with the help of GoFundMe and many kind strangers and friends.
Wow.
So they helped to keep me alive, and so I'm now 5 years out of any, or even maybe slightly longer than that, out of any kind of treatment, and things are
Emma, yay!
So so that's news.
How long were you having the immunotherapy and radiotherapy for? How long was that? Because so the chemo was like 6 months, and then the second time around, how long was that lot of treatment for you?
I initially, they'd sort of teed me up for a few years of it.
Oh no, thank you.
But actually, when I started the immunotherapy, I didn't have many side effects from it. So compared to chemo, it seemed like an absolute walk in the park. I'd started that, and then I had such a large tumor, and actually the hypercalcemia that Will talked about, that's a bit, it's where your thyroids are a bit affected by the tumor, and they basically your bones start giving calcium to the blood, so it's a bit like poisoning yourself. It's not very nice. I had to try and keep up with that, but we decided to do radiotherapy to try and see if it would combat a bit of that, and maybe reduce the tumor it was a very large tumor at that point, down, and it kind of had an immediate effect, the radiotherapy, in combination with the immunotherapy. And so I only had a short burst of radiotherapy and carried on the immunotherapy for about, I think it was about a year and a bit. And then I reached my tolerance with it, sadly. So I started having lots of horrible bowel issues, which
oh no,
that with immunotherapy, it's pretty horrendous. They took me off it, and unfortunately, I couldn't go back on it again. So I'm on a pause still, but I find myself still paused. 5 years later. So I don't think I'll be going back onto it again. But
and are you how does the kind of, I hate all the jargon I'm using today, but like the landscape for you? So do you go for regular checkups, or what's the kind of situation now? So you're not having active treatment. So but isn't it right from when we chatted the other day that I couldn't confidently say, oh, and Emma is now completely cancer free?
Yeah, so I had hoped, like many people that go through all of the cancer treatment, that you can become the wonderful place is no evidence of disease, where when you have a scan, they look and see if they can find any cancer, and they can't. Unfortunately, in my case, the giant tumors that were reduced down from this quite large tumor size shrunk down to these tiny little tumors. But I think it's probably fair to say they're sort of scar tissue, or sort of necrotic tissue in there that isn't sort of active cancer. But they are still there, and I'm sort of fortunate they're in my womb area, so it's not something that really affects me. But and they can't be removed because they're very near my bladder, so I sort of just have to live with them. But I've come to peace with that, because I know it's a very active and aggressive type of cancer. So if they were in any way active, they would have got me long ago.
They would have started doing something, wouldn't they, by now, if they were going to do anything? How does it feel, kind of not being able to say you're cancer free, but also not having now the daily worry of it spreading and going for treatment? Because I can imagine it's better than when you're having treatment, but still not totally like that chapter's completely closed, that book's back on the shelf.
I think so you sort of mentioned a bit before, my current regime is I get a scan. It used to be every 3 months, but and a blood test, but it's dropped down to every 6 months now. And so I think you become more confident as you go, and you can kind of recognize when things don't feel right. So I feel more and more confident now, and I based on some of the other stories I've read, I feel more confident that this is in the past, and I just, in a way, I'm sort of negotiating down the amount of time I kind of spend in hospitals now, and it feels, every 6 months feels very, very, it's easy to do. You can kind of go in, and you know the routine after many years of doing it. So so it's not too invasive in my life, and so I do feel like a chapter is closing now.
And that chapter's closing, what is the kind of obviously carrying on for checkups when you're invited, etc. But everybody, like next chapter wise, everybody always wants to know. I've had everyone I know that's had a gynae cancer that is, under the age of 45 gets asked the question, what does this mean in terms of like fertility and things like that? Because that is just the hot topic, isn't it? If you're someone that hasn't had kids and you have a gynae problem, that as soon as they've sorted the gynae thing out, then everyone's question is fertility.
Well, actually, something else that Will mentioned before was, like, obviously the preventative of this cancer, if you had it in your family, would be to remove your ovaries and remove the risk. But most people in their 20s don't want to do that, and that covers most of the people being diagnosed with this cancer. So I initially removed that first tumour, and then was very keen where I could to keep my fertility. And actually, after chemo, everything looked pretty good. I'd done my best during chemo to keep the other ovary asleep by sort of taking a few different types of drugs. And then, unfortunately, when it came to the decision about radiotherapy or not, that was a kind of a definite, there will be no fertility past radiotherapy. And I was in a spot where, in a way, it wasn't a difficult decision. I had to do it, so to stay alive. But
it's your life, isn't it? It's somebody saying you have a better chance of being alive next year if you take this option.
Yes, and then it's a big price to pay, especially for somebody that's in their early 30s, as I was at that point, where all my friends are just starting to have children, and I'm there closing the door on that possibility. And
Yeah, of course.
I couldn't do any kind of IVF. I couldn't retrieve eggs.
I was going to say, was there not there wasn't time to freeze eggs and things?
Unfortunately not. Again, it would have been a risk to my life to do it, so I decided not to, and it's one of the hardest things, actually, of all the things going through cancer, is the repercussions of what that means for the rest of your life. But my hope is, and I'll start a family another way, but I just have to come to terms with the fact I can't start my own family with I couldn't have my own children now. So it's in a way, because it's so black and white for me, that's been a bit of a blessing too, because there's no what if there. It's a definite no. So
yeah, it was that you had to lose the fertility to not lose your life. So as hard as that is, that was kind of, at least you were told what had to happen rather than kind of had to make decisions in a way.
Exactly. Yeah,
it's interesting, isn't it, how difficult, it's obviously a really difficult discussion talking about the fact that you can't have biological children. There's different, obviously, so many different ways to be a parent, but I think it's interesting, and thank you for talking about it, because I think people will so often assume that, oh, Emma's not having her immunotherapy anymore, she's fine, great, that's that. And people often don't see that once you're, out of the operating theatre or the chemo chair or whatever it is, that doesn't mean that everything is sparkly again.
No, people have to make some very, very hard decisions in order to sort of prolong or, prolong their life. And sometimes, and when I did the radiotherapy, I didn't even know that was going to work. So I knew that I was sacrificing that, but not even knowing it would definitely help me. But when it did, I went in thinking, oh, this is just a really sad thing I have to do. But because it helped me so much, in a way, that also helped me come to terms with the fact that I'd had to make that decision. So that was helpful.
Of course. And Emma, just while we wrap up, and thank you for being such a wonderful guest and being kind of very open and honest, but also kind of no frills, and just kind of telling us what happened, and also that, whilst it's obviously great that you're in remission, that not everything is sparkly and there's still other things to deal with. I think that's a very honest and kind of fair account of what people have to go through when they get particular types of diseases. But to kind of end on maybe a slight upper, if you were to, so I remember when we chatted yesterday, you were like, oh, if I'd have seen a chat like this right when I was diagnosed, it would have been helpful and hopefully helpful to the people watching. What would you say to somebody who, I mean, there are so few of you, so I hope no one watching has just been diagnosed with the hypercalcemic small cell ovarian cancer, but if someone has, what, as someone that is pretty much out of the other end of it, what kind of couple of things would you say to someone, or to yourself when you were first diagnosed?
One thing I'd like to say, just for everyone, which is, I guess, always say, which is for all cancers, and all things really medically. I think I was persistent, and I chased stuff up with my GP and my doctors. Something wasn't right. And again, Will mentioned this too. If something goes beyond weeks, that something's not quite right. You've got to follow it up. And so that was why I was diagnosed early, and that's how I caught it. And everything turned out pretty well, considering I was up against some significant odds. And then the other thing I would say is, in this type of tumor, often doctors haven't seen it before, so you have to be your own expert. So if you don't feel like you're getting the right care, you should push, and you should read, and you should try and follow stuff up yourself, and then doctors hate when patients come to them and say, I've got an idea that I found on the internet.
Woo, here I am.
I would often start my suggestion with, I have read this on the internet, but
oh no.
I think if you find really good sources of information like the Eva Peel, Will's doing, there are some brilliant forums as well, which is the other thing I'd say is, if you feel like you've got a rare cancer and there's no one else that you've kind of met that's going through the same thing, they are out there. You just have to look and find them. There are some people that are going through similar, if not exactly the same things. And then they'll help you as well with that wealth of information to then take to your oncology teams for ideas. So two of the ideas that saved my life were ideas that came from other patients that had said, I've tried this. And then because they went from, unfounded, Google searches where they were quality ideas that my oncology team took seriously. But I do think that was the key thing in saving my life, was finding help and being persistent and a little bit pushy at times, and fighting for it.
Fighting for it. Emma, thank you so much for just being an amazing advocate, a wonderful fundraiser, and just a babe. I really, really appreciate you taking the time and talking to me. Thank you, darling.
It was lovely.
Thank you, sweetie. See you later.
Bye. Bye.
Thank you so much to everybody that watched this session, and we're going to put the recorded live chat up on all of our socials, and we'll include in those captions the links and email addresses and all of those things that were mentioned throughout this chat with Emma and Will. Massive thanks to Emma and Will for taking their time, sharing their stories and expertise. This session wouldn't have been possible without them. Thank you to Disruptive for doing all of this screen and hosting stuff just out of the goodness of their hearts. They are wonderful. Thank you everyone for watching. Do follow the Eva Peel on social media, etc., where you can catch up on our posts about ovarian cancer from the whole of March. And until we meet again, thank you so much for watching.